Assalamu alaikum. Now I would like to talk about gynecologic tumor. In gynecologic tumor, according to prognosis, we can remember CEO, that means cervical, which has best prognosis, cervical, which has best prognosis, and diagnosed below age 45. Then endometrial, then ovarian. Endometrial usually diagnosed at about 55 years old, and ovarian which has worst prognosis. So in CEO, according to best to worst, according to best to worst, age duration is for 10 years. Best cervical, then endometrial, then ovarian. And cervical is usually diagnosed below 45, and endometrial is within 55, and ovarian is the worst prognosis more than 55. Now, vulvar pathology. In vulvar pathology, first I would like to talk about Bartholin cyst and abscess. In Bartholin cyst and abscess, why this has happened? Uh, this is happened due to blockage of Bartholin duct, causing accumulation of gland fluid within that duct, may lead to abscess, and secondary to obstruction and inflammation usually happens in reproductive age. Usually happens in reproductive. So Bartholin uh, cyst and abscess happens in the reproductive age due to blockage of Bartholin gland and causing accumulation of that gland fluid. Then next one is lichen sclerosis and lichen simplex chronicus. Lichen scleros means hardening, lichen sclerosis, and lichen simplex chronicus. What happens in lichen sclerosis? It is chronic progressive inflammatory disease caused by porcelain white plaques. In here there is white plaques. Near about the clitoral area there is white plaques. Suppose this is clitoris and there is whitish area, white plaque, that can be hemorrhagic, eroded, or ulcerated. May extend to the anus, producing a figure of 8 appearance. So lichen sclerosed means hardened. There is figure of 8 appearance. It may happen in prepubertal, peri and postmenopausal, and it can cause intense itching. This is intense itching, and dyspareunia, painful quietus, pareunia, dysuria, painful micturition, and dysphagia, painful defecation. So painful micturition, painful defecation, and painful menstruation, painful quietus, everything happens in lichen sclerosis, and it is sclerosed, hardens, and it can lead to development of squamous cell carcinoma. And lichen simplex chronicus, it is simple, and it causes hyperplasia of the valvular squamous epithelium. It is leathery. It is leathery thick valvular skin with enhanced margin. Uh, thick valvular skin with enhanced margin, thick vulvar skin with enhanced marking due to chronic rubbing or itching. There is there is chronic rubbing, there is chronic itching, and it causes enhanced skin markings. It does not cause, there is no risk of squamous cell carcinoma. So lichen sclerosis is sclerosed thick and it can cause squamous cell carcinoma, and simple lichen simplex chronicus. In here there is also itching present, but it does not cause squamous cell carcinoma. There is only intense itching. On the contrary, lichen chronicus, on the contrary, lichen uh, sclerosed, lichen sclerosus, lichen sclerosus, there is dyspareunia, dysuria, dysphagia, increased risk of squamous cell carcinoma, and there is whitening. There is whitening or whitish plaque around the clitoral area. It may extend up to the anus too. These are the non-neoplastic, usually non-neoplastic valvular pathology, and in neoplastic valvular pathology, there are two things. One is vulvar carcinoma, another is extramammary Paget's disease. There is extramammary Paget's disease. In vulvar carcinoma, what happens in vulvar carcinoma? There is carcinoma from squamous epithelium lining the vulva. Carcinoma from squamous epithelium which lines the vulva. It is rare. And it presents with leukoplakia. And biopsy often required to distinguishing between carcinoma and from the other cause. Vulvar carcinoma, it may be HPV related, and uh, it may be HPV related, or it may be non-HPV related. In HPV related, it may happens with the help of 1618. These type of high risk human papilloma virus can cause vulvar carcinoma, and the risk factors are multiple partners, uh, early quietarchy, and usually happen in reproductive age, but in non-HPV usually happens in older age stage, more than 17, and due to long standing lichen sclerosis can causes these vulvar carcinoma. So vulvar carcinoma are of two types: HPV types, non-HPV types. HPV types are 1618, and it can cause vulvar carcinoma usually in a patient with uh, a patient with multiple partners, early quietarchy, and usually in the reproductive age female. But in non-HPV vulvar carcinoma, usually from non-standing lichen sclerosus and female more than 70 years old. And last, neoplastic is extramammary Paget's disease. Extramammary Paget's disease. In extramammary Paget's disease, it is intraepithelial adenocarcinoma, carcinoma in situ, CIN, carcinoma in situ, intraepithelial adenocarcinoma, low risk of underlying carcinoma versus patches disease of the breast, which is always associated with underlying patches disease of the breast, always associated with underlying carcinoma. But a extramammary patches disease are of low risk. It usually presents with pruritus crusting and ulcer, pruritus, casting and ulcer, pruritus, casting and ulcer. And little topic regarding another little topic regarding hymen is, this is very important, this one, this imperforate hymen. Sometimes there is imperforate hymen, imperforate hymen, incomplete degeneration of the central portion of the hymen. There is accumulation of the vaginal mucus at birth, accumulation of vaginal mucus at birth. It is self-resolving, it is self-resolving, bulge in the introitus, bulge in the introitus, and if untreated leads to primary amenorrhea. If untreated, it leads to primary amenorrhea. Cyclic abdominal pain, hematocolpos, accumulation of menstrual blood in the vagina, bulging and bluish hymenal membrane. There is bulging and bluish hymenal membrane. If there is bulging and bluish hymenal, if I get that word, bulging, bluish hymenal membrane, that means it indicates that hematocolpos, that accumulation of blood in the accumulation menstrual blood in the vagina. If you get this point, then it is confirmed the diagnosis would be imperforate hymen. Hope you enjoyed the vulvar pathology.